I grew up in North Carolina, small town, Lincoln, North Carolina, which is a little place between Gastonia and Hickory. If you put a pin right on the map there on 321, that's where we are. Most people aren't real familiar with Lincoln because it's just a little small cow town. But so that's where I grew up. I've always been interested in medicine per se, science and that sort of thing. I mean, even whenever I was in 4th grade, I drew a picture of an eyeball in 4th grade that had the parts like the iris and the lens and all the parts of the eyeball, and had that up on my wall. So for several years I wanted to be an ophthalmologist, and my parents were wonderful. They were not college educated. In fact, I was the first person on the Beaver side of the family to graduate from college, so it's a very proud moment for my grandparents in particular, my Mama and Papa Beaver, sort of what I call them affectionately. But I wanted to be a physician, and so when I was in college, I actually worked in an emergency room as an ER tech or an orderly, and I loved that. That was a fantastic job, and that was whenever I was at the University of North Carolina, and I started working that graveyard shift, and it was me, a nurse, and a doctor. So there was just 3 of us, and the doctor that worked there, there was 2 or 3 of them, but there was one in particular that kind of took me under his wing, and he was very, very helpful, very supportive of me. It was kind of I guess it was a fragile point in my life because I kind of gotten the wind taken out of my sails a little bit because I diverted from my original quest to go on to the Coast Guard Academy and fly helicopters was what I was thinking at that point, which was a diversion from medicine too. We all meander a bit, don't we? Yeah. So, but he was very, very helpful. He encouraged me to be a doctor. He was like, I think you have the brains to do it. I think you have the people skills to do it. I think that you would make a good doctor. So he encouraged me to go on and do that, and that's why I really got interested. And he used to pull me aside and show me stuff on x-rays and ask me questions about patients. I mean, he would know the answer, but he would take time to teach me, and I really appreciated that. And just working in that small little group was a very good experience too, with just me, the nurse, and the doctor, from 11 to 7, and you can imagine the stuff we saw in the middle of the night. Yeah. It was at that point that most of the young doctors that were coming through the ER were saying, "Don't be a doctor, don't do it. Insurance has ruined us. We should be an accountant." I did not want to be an accountant. So I thought I wanted to be an ER physician, but I was also a cheerleader at the University of North Carolina at the time, and during one of our practices, which was actually on a Friday afternoon, we were doing basket tosses, or a circus stunt basically, and we threw a girl up, and she came down and it busted out my front tooth, and I had to get on an airplane that afternoon and fly down to see my girlfriend at the time. Had to meet her parents for the first time. So I show up in Jacksonville, Florida with half a tooth, saying, "Hey, I'm Zan Beaver, I'm dating your daughter, and I'm from North Carolina with half a tooth." So it was a very embarrassing weekend for me. I went out and met all her friends from high school. Luckily, I ended up marrying her. She's my wife now, so we made it through that. I had to go all weekend because we couldn't get into a dentist, but on Monday I came back, and my mother was able to get me into a dentist in Chapel Hill, North Carolina, and he fixed my tooth, and I thought it was magic. I really felt like this is incredible. It was so impressive to me that I decided at that point, when he fixed my tooth in about an hour and a half, that this is what I wanted to do, because it was so dramatic, and I realized how big of a difference